I had a 31% chance of suicide.
Mm.
And I thought, I love my wife, I love my kids. Like, I'm not going to commit suicide. But what is it from the way that I answered these questions honestly that I'm, that I'm at this high of a risk? I have a 1 in 3 chance of killing myself.
Everyone in healthcare has a story they never forget. Some are beautiful, some are difficult, but most are never told. This is the space where doctors talk about moments that change them. Welcome to HUMED, where we talk about the emotional, moral, and human realities of medicine. I'm Dr. David Spiro. Thank you for being here. Please hit subscribe wherever you get your podcast information. I'm incredibly honored today to have Dr. Rob Beck with me, who is also a podcaster, host of The Interesting MD, and I hope to be honored to be on his show. He's coming on my show. He actually hails from Nashville, Tennessee, not far from Little Rock. He went to college at the University of Tennessee, and he received his MD and Master's of Public Health at Tulane University in New Orleans, and then stayed on there for residency, where he did a residency in internal medicine, taking care of adults. And when we take care of adults in the pediatric ED, we want to get them to Rob. We want them out of our pediatric ER. So thank you for taking care of the adult population. He's a triathlete, but I will say maybe most importantly, I don't know him yet, but I would say most importantly, he's a husband. His wife is also a physician, and a proud dad of 3 children, ages 20, 18, and 16. And the middle child, I found out, is also a triathlete. And welcome to the show, Rob.
Thank you so much for having me, David. I really appreciate it. This should be fun. And yes, please come on to my podcast.
I would love
We just
that.
hadn't sorted out a date yet, but I promise I want you to come on.
I have a
Love to hear
story
about it.
about Canada. I have many stories about Canada. So tell me a little bit about your story. I want to know a little bit more about you, and what story you wanted to share with the HUMED crowd today.
Yeah, absolutely. And again, thanks for having me. So I was born and raised in Tennessee, lived in New Orleans for 10 years, did a year in Cincinnati after university as well, but then moved down to New Orleans. After we finished 10 years in New Orleans, we thought, well, it's probably time for us to leave. And so we went to Nashville and joined an internal medicine group there. We were traditional internal medicine as part of a larger multi-specialty group at one of the big hospitals there. And we did that for about 9.5 years. And once COVID hit, the stress of doing primary care in a traditional internal medicine practice had been wearing on me for a long time, to be honest. And I was starting to feel that pressure building up. And my wife is Canadian. We met when we were in school in New Orleans, and our kids were being isolated during COVID. And there was just a lot going on and things changed. And that really, I think, was kind of when the straw broke the camel's back at that point. And burnout really became something that was profound for me. Right before COVID came out, I thought, I'm not dealing with stress very well, but in looking back, I was always angry. I was really short tempered. I was angry in between my patients, but I was happy to see my patients. Nothing made me happier than to walk through the clinic door and sit down and just be with my patients. But the second I went out of the door, I became angry and I was just frustrated and overwhelmed by all the things that were happening. And my wife just suggested, hey, I'm Canadian. We could move to Canada. We, can just break free of all of this. And it's a much longer story than that, but I finally just reached the point where I was like, I can't keep doing this.
Mm.
And there was a survey that was coming out, and I never told my wife this at the time. In fact, I never told anybody this until I was talking on my podcast last June. But there was a physician wellness survey that came out. And I answered the questions. I answered them pretty honestly. And it was not like I answered 1 out of 10 on everything that they did. But it came back and told me that I had a 31% chance of suicide. And
Wow. Wow.
yeah, it was probably 8 or 10 questions, I don't remember now, but I had a 31% chance of suicide.
Mm,
And I thought, I I love my wife, I love my kids, like, I'm not gonna commit suicide, but what is it from the way that I answered these questions honestly that I'm that I'm at this high of a risk? I have a 1 in 3 chance of killing myself to
mm,
escape this?
mm,
And that really helped me that jarred me. And I was looking for other opportunities. And when it became a reality that we might be able to move to Canada, I j- I jumped at the chance, to be honest, to try something different. I had no idea what internal medicine was like in Canada. I had no idea what life was like in Canada. And we kind of settled on British Columbia. And I'd never been to British Columbia. And
mm.
so we were able to get a job
Where
here.
does your wife hail from in Canada?
So she's from Toronto, so north of Toronto are the
Completely
suburbs.
on the other
Yeah, on
side
the
of Canada.
complete
Yeah.
opposite side, and we just were looking around and we thought, "Well, I don't know, Toronto's maybe not where we wanna go, and we want something a little more fun and exciting," and it was gonna be too expensive to live in downtown Toronto with 3 kids and 2 big dogs. So, we'd never find a place, we didn't think, so we were looking at British Columbia. My sister-in-law is an internist in North Vancouver, and she said, "You guys have to come to British Columbia. It's great here. You're gonna love it. It's beautiful." Uh, Andrea, my wife, had been to British Columbia once for spring break, and she landed, took a bus to Whistler, skied at Whistler, then took the bus back to the airport and left, and that was her extent of experience in British Columbia. And my experience with British Columbia started when we drove across the border because this was
Wow.
all during COVID and there were, there were quarantines. And so we would have had to taken over a month off of work just to come up and visit because we would have to fly up, quarantine for 14 days, go do whatever we wanted to do, fly back and quarantine for 14 days. So it wasn't really practical. So we just decided we're going to do it. So we got jobs and we found a house. We bought a house on FaceTime. My in-laws were nice enough to come out here because they didn't have to do a quarantine, so they flew out and they went around and they checked out neighborhoods and got the feel for the neighborhoods and then went into the houses with our realtor. And so we bought the house, quit our jobs, and moved to
Wow.
Canada, to Victoria, British Columbia.
So I want to get back to your move. So you moved from being a chief resident in Tulane. You had spent 7 to 8 years, I'm
Yeah, so
guessing.
we'd been in New Orleans for 10 years. So we
10
both
years.
moved down. Yeah, we both moved down at the same time to get our masters in public
Hmm.
health.
Hmm.
I really thought that I was just going to go down and get my master's in public health and go work in an NGO somewhere in Africa. That was
Hmm.
kind of was my thought. And while I was there, I decided, oh, I think I actually do want to go to med school and really buckled down and was able to get in. So,
Wow. So you moved from New Orleans and then you spent 10 years there and then you went back to Nashville where you grew up.
mhm,
And so I'm
yeah.
making an assumption that your parents were still in Nashville
Yeah.
when you moved back?
So I actually grew up in Chattanooga. It's a
Chattanooga.
couple hours outside of
Mhm,
Nashville,
mhm,
and I'd never lived in Nashville, but we thought that that was going to be really close and that we'd be able to see my parents and my family, and
mhm,
had a lot of friends in the area as well. But it was the job that was also really spectacular. So
hmm.
we were very happy about that, and it
So
was a great practice.
and
So
you loved the you liked it, and it was a private practice.
it
So you
was,
were
yeah.
were you an owner? Were you part of,
No, no, it was a hospital. Sorry, it was a hospital-owned practice,
I see.
for HCA. We were at the flagship hospital for HCA right across from HCA world headquarters there, so, um
And were you working in a outpatient clinic? Were you working as a hospitalist? Were you doing both?
Yep, so outpatient, clinic, well, we were traditional internal medicine, so we
Mhm,
did primary care, we built up our practice, but we were located my office was, I guess 40 or 50 feet from the hospital. So
mm,
attached on the same floor. So my office was on the fourth floor of the outpatient building. And then I walked through a door and I was on the fourth floor of the hospital. And so I was able to go and take care of all of my own patients when they would get admitted or when they needed something. I was the one who took care of my patients. So we were a hospitalist as well, but it was only our patients or on the weekends covering the patients for our practice, for our other
Well,
partners.
it's very interesting to me that you went from almost the extreme in Americana culture of uh, HCA. For those of you that don't know, is a for-profit. Correct me if I'm wrong, Rob, but
Oh
it's a
yeah,
for-profit based
very for profit.
corporation. So it's capitalism on steroids in healthcare, which some people feel could be a conflict of interest. But you went from that practice environment to an environment where I'm assuming it's much less so in Canada. Is that a
Yes.
fair statement?
Yeah. 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 So working in a single payer healthcare system is very, very different. Again, HCA, they treated us very well.
Hmm.
And I tell everybody that our hospital, we were at Centennial Medical Center, it was Disneyland for doctors. I mean, it has everything that you needed multiple PET scanners, innumerable CT scanners, MRIs, PETs, like anything that you needed, you had at the subspecialist. We did everything but transplants there.
Mm.
And so anything your patients needed, you got it. And if your patient needed an appendectomy, I would have patients walk in who had appendicitis, and the surgeon would come to my clinic and then take them over directly to the operating room
Hmm.
and recover them overnight or send them home later that day. And then that was it. I mean, it worked that fast. It was that great of an environment. So again, I wish that I could blame it on HCA or the capitalism or whatever else. It was a system that I knew. It's not something that I knew any better, but it was still something that completely overwhelmed me
Hmm.
and just gave me a 31% risk of suicide. So,
So I'll be a little bit vulnerable with you, and then maybe you can be a little vulnerable with me, being guys.
sure.
But I um, uh, really resonated with something you said, and I want to ask you a bit more about it because you said that you had a 31% chance of suicide, and then before that, you said that you had felt irritable and just unhappy on some level, and
Hmm.
irritability is an interesting word, right? Because irritability can mean there could be some form of depression or sadness or frustration or anxiety or all of the above and other things that creates someone who's irritable. And I have been irritable in my life from time to time. One, because I picked a specialty where we work 24/7. And so there
Yeah.
are times where we have lack of sleep, and you experience that for sure when you were in your training. And we all did in medical school to some degree. But um, I, I'll share with the audience that in 2014, I left one of the best jobs you could have. I helped start a pediatric ER and that didn't exist at Oregon Health and Science, and we helped start a fellowship training program. Me and Garth Meckler, who's actually at BC Children's
Oh,
right now, and a colleague of mine that moved to Canada, who you can interview on your show. So he and I were working together in Portland, and we did all these amazing things in terms of beginning pediatric emergency medicine, my specialty in Oregon, and I was there for 8 to 10 years and really enjoying my job. And I had a boss at the time. Won't get into details that I felt was emotionally abusive towards me, and I became very irritable, and I needed to have a close friend of mine say to me, it was your wife, and at the time it was a close friend who said, You're not well. You seem unhappy. You seem irritable." Um, I forget the exact words he used, and I said, "Well, I can't leave my job." And he said, "What do you mean?" And he said to me, I said to him, "I can't leave my job. This is the only academic PZR in the state of Oregon, and my kids are here, married, uh, can't really leave." And he said something to me that was almost like a white light. He said, "Aren't you a physician?" And I said, "Yeah, I'm a pediatrician, pediatric ER physician." He said, "Yeah, but you're a physician. Can't you do other things? Do you have to do this?" And at the time, I had started a company that was sort of a side thing and around case-based learning called Real DX, and it was almost like a bright light, like, wow, maybe I can do other things. And then I started to explore those other things, and it was like a complete lifting of my own veil at the time. This is in 2014, where I had the opportunity to pivot, but still stay within the field of healthcare. And with some self recognition, with a close friend of mine essentially telling me, "You're not right, and something needs to change."
Yeah.
And so, and it was hard. It was really hard. Leaving a place that I felt comfortable with, that I felt like I could grow into, but knew that it was not an emotionally safe place for me. And I was becoming really, really irritable. And then on top of it, you have all those things that happen when you are an emergency medicine physician, which is 2 or 3 nights a month, you're up all night. And so my emotional reactivity was high and I
Yeah.
was irritable. So what what was going on? If you could you give me a little bit more detail, if you feel comfortable
Oh, of course.
telling me about your irritability? Because that was sort of there was an awareness of it, and I'd love to dig in deeper into that irritability that you were having,
Oh, absolutely. Yeah.
because I think we all experience that to some degree in this crazy world of healthcare.
Yes. It was, I would love to say that, oh, this was all just because of all the prior authorizations or whatever. It wasn't. I mean, that was part of it. We had office people that took care of a whole lot of that stuff. We actually had this wonderful group. But it was,
Can you explain, if they were learners
yeah.
or people from Great Britain or
Oh, yeah.
India,
Sure.
what a prior authorization
Yeah.
is? Because I have to deal with it as an adult patient, me as the patient.
Yeah.
So could you explain what that is?
Yeah, absolutely. So, if in the United States, when your doctor wants to order a test or wants to admit you to the hospital or you want to have a surgery, or sometimes if you need an expensive test, even if it's a blood test sometimes, or a medication, the insurance company will deny that claim initially and say, no, you need to have a prior authorization. You need to get permission from us. You need to explain to us why you needed to go to this step, why you needed this medication, why you needed an MRI instead of an X-ray or a CT scan. No, we don't want you to go straight to an MRI. Even, we would say that you need to go through this first. And so it requires that you get on the phone with the hospital or with the insurer, and you go through and you get a case number when you send off the test, and then they send back a fax to your office and say, nope, here's your case number, call this number. And so you have to take time out of your day that's already very, very busy, and you have to get on the phone and you have to call them. And it has to be the doctor for the most part. But we do have some people that can help out with that. But you have to go and you have to get permission from the insurance company, and you have to get on what they call a peer to peer sometimes, which is where you call and you speak to another doctor. It's not necessarily an internist. It's not always, a pediatric ER doctor or a vascular surgeon or whatever. And you have to get permission. You have to convince somebody else with the insurance company to spend that money to do this for you, for your patient. And that's that is a prior authorization. And that happens with medications, that happens with lab tests, expensive imaging studies, surgeries, everything, that there is a process that they go through. And my understanding is after I left that now the big insurance companies, I guess all the insurance companies now are actually using artificial intelligence to basically go through and automatically decline all of these, almost every one of these requests. And you have to then go back through and fight with them to get them to pay. And I assume that it's I won't say yeah, I will. I'll say it. That I think that it's they have to make you prove that you want it bad enough for your patient because there's nothing the patient can do. So now the patient getting the care isn't just about you seeing them taking care of the patient and then putting in that order and then following up with all the other care. It is now, do you care enough about this patient to call to get them that CT scan or to get them that MRI or to get them the surgery or get them this medication that they need? And that is completely uncompensated. That the insurance company would never allow you, they would never pay you for this process. They pay you for the visit and that's it. So,
But you're involved in the process because you're advocating for the patient who needs something that will help them with their healthcare, whether it's
absolutely.
medication or whether it's imaging or whatever, some
Yeah.
sort of test.
Any part of that, yes. And if you are not calling and you are not advocating, then your patient is suffering. Your patient is without something that you think they need. And an insurer can definitely come back and say that it's a cost saving process or it's evidence based or whatever else. I will say that in 5 years of practicing in a single payer healthcare system, I've never had to make a phone call. And I don't believe that I am wasting any more money or practicing more inefficiently than I ever did when I was in the mecca of healthcare, which is Nashville, Tennessee.
So you said something there. We're sort of going into a little rabbit hole with prior authorizations, but I think it's important. No, but that's a big difference. Correct me if I'm wrong between the U.S. healthcare system and the Canadian healthcare system. You have little or no prior authorizations in the way that you practice. Is that fair?
That's definitely fair. I think that with some prescriptions, I don't do primary care anymore. As an internist, I'm a specialist now, and so I only get referrals. I don't do that much primary care. I don't do that much clinic, although most internists do. But I think that for things like PCSK9 inhibitors, those are the things that I use. But for PCSK9 inhibitor, which is for the listener, is a new injectable cholesterol medication that you can use every 2 weeks that you inject it. Very, very expensive, but extraordinarily effective.
Mm.
And so, yes, we do have to fail a couple of things. Like that's not something that the government wants to pay for right away. So we have to go through a couple of steps and then fill out a form for that. There are other doctors that have to do that a lot, but that's I don't really prescribe it that much, but for imaging test or anything along those lines, I do not have to go through that. I do not
It's
have to go through that.
It feels like, it's a more evolved way of practicing, medicine, just because if you think about it, in 100 years from now, just thinking about 100 years, let alone AI and everything else that will be different, but in 50 years, there's no way the US healthcare system can exist in its current state, in terms of the expenditure, in terms of this process. I mean, I could not imagine, being an internist in the States. Let's say I was in private practice and I wasn't at HCA. Let's say I didn't have staff and or I was paying staff. It just would seem overwhelming that
Yeah,
every other patient or every third patient, I'm at the end of the day, I see 25, 30 patients or 20 patients, and I have 8 prior authorizations or 10 that I have to deal with at the end of the day. That's
yeah,
just on my another thing on my list to do that really isn't about decision making. It's really it's part of the correct me if I'm wrong, but it's really about the administration of medicine and advocating for
that
your
is
families.
that is the administration of medicine. That is not medicine. That is not medical decision making. That is yeah, that is the administration of medicine, and that is what is inflating the cost of healthcare. It's not me ordering an MRI. doctors don't just wanna order MRIs all the time, and it's paying a doctor and paying all of these people to accept this, and that's where a lot of this administrative cost of medicine is coming from, because I mean, instead of the insurance company paying for the MRI that
Mm,
they could have gotten a better deal on or whatever else, they have paid somebody to take that in, reject it, generate paperwork to do that, and then give me another person that I have to talk to, and then another person that would schedule that person that I would talk to schedule my peer to peer, and then they would have to get that person on the phone call. They would have to have a doctor that they pay in the background to be there
mm.
to accept or reject. So,
Well, I wanna ask you a question about internal medicine because I'm naive about it, in terms of US and Canada, because
mhm,
in, the US, there are a few specialties that are primary care specialties. There's pediatrics, there's family medicine, there's internal medicine, and then there's some people that do internal medicine, pediatrics, a combination of both, and
mhm,
can see both adults and kids. Um, and in the States, in most suburban areas and urban areas, the vast majority of children are cared for by pediatricians who are primary care specialists. And then out in the rural area, and I didn't mention this to you, but I worked on a Native American reservation in Oregon the first time I was there before my fellowship, paying off my debt, which is another issue in the US healthcare system. But I
yes,
paid off my debt, and I was a pediatrician in a rural town, but I I saw some of the children, but the vast majority of the children in this rural area I was working with in Oregon were cared for by family physicians. In
mhm,
the UK, um, in the pediatrics world, pediatricians are specialists, and most of the primary care are taken in the UK and the national health system there by family physicians and APRNs. And so, is Canada more like the UK? And what is it like? What's the paradigm? Because you had said you're a specialist in
yeah,
internal medicine. Can you
correct.
explain to the audience how internal medicine is practiced in Canada?
Yeah, sure. So, yes, in Canada, in the single payer healthcare system, everybody should have a GP. There are problems with that. So, a family medicine doctor, they should have one of those. And so, everybody should be funneled to them. And then from there, if they do well women exams, they do all of the usual, you know, pregnancy pediatrics, primary care, everything. So if they have heart failure, arrhythmias, refractory hypertension, acute renal failure, liver disease, complex thyroid issues, then and the family medicine doctor needs a little bit of help, then they will refer them on generally to internal medicine. And that's kind of where we scratch the surface and we go a little bit deeper as a specialist. So everybody needs a referral. We do get referrals from the emergency room as well. We do a lot of malignancy workups and uh, anemias and chronic things like that. But also, if somebody has an acute rheumatologic problem, sometimes they'll come to us first. Or if there's a suspicion of it, then we would be the ones to kind of make that diagnosis. And then we would send them on to the relevant specialist. But in internal medicine, we will do a lot of stress tests. If people come to us with chest pains, then we can do stress tests. At least in British Columbia, we do a lot of reading of the EKGs and Holter monitors from time to time, and do more of a higher level, more complex patient care. And if we need to send a patient for a pacemaker or an angiogram or something like that, then we'll refer them on. Or if if there's like a real complex renal problem, then we'll send them over to the nephrologist. But we end up seeing all adults, generally about 16 and over here. So they consider children at 16 an adult here, so they will at least from a pediatric or from a medicine standpoint. So they'll all come to us for starting about 16, and that's where it gets to be multiple systems involvement or really complex or problematic, difficult to control issues,
Mm.
or a kind of a diagnostic quandary, I guess you could say. So if there's a big diagnostic mystery, then they'll send them to us first to kind of put it together in a bigger picture.
Well, I'd like to get back, if we can, to where you were in your ninth to 10th year of practice. And
Yeah, sorry about that.
we,
Yeah, I've kind of been all over the place
hey,
with
hey,
you.
listen, Rob, I was vulnerable. So now I'm turning the table. Okay.
Yeah,
It's your
absolutely.
turn. I'm kidding. But
No,
I would love to know. I'm just curious.
yeah,
Like,
you're not going to let me away from it, huh? Okay, so this time
what,
I'm going to answer it.
well, you went into prior authorizations and then we went down that rabbit hole. So,
All right. So it was, I felt this pressure that all of these people's lives, I had about 2,000, 2,200 patients by the time I left. And I just felt a pressure that everybody's care was all on me. And then I started to worry that I was going to miss something. And it just became, and that should be okay, great. Well, I'm going to work harder and I'm going to work more efficiently and I'm going to make sure that I stay on top of everything. But it became overwhelming and it became paralyzing and I just couldn't do it. My nurses would sit there and say, okay, the patient's calling for their labs. And I couldn't, I couldn't do it. I just, it was becoming so overwhelming and it just kept beating me down. And you get in this vicious cycle where my labs are hanging over me and I look at my lab count and now I have 400 labs in my inbox that I need to get out. And I have all these phone calls that I need to return and I need to call this person. I need to call that person. I wonder how this person's doing. Is that CT scan back yet? And you become paralyzed. I mean, you're just in quicksand. And the more you move and the more you want to do something, the worse and the more trapped I got. And that made me more angry. And just with my kids, I would say, so I used a kind word, irritable. I was angry. I
mm,
was unpleasant to be around a lot of times. And my
mm.
kids had this joke at the time they were, much younger back then, but there was this joke that every time anything happened, I would grab the bridge of my nose like this and that became a joke around my house. And it's like, why did I need to be that upset? Why did I need to fly off the handle for something like that? But it became a joke around the house. But
And
I think that
did the joke bother you?
it did. Yeah, it did. Once because it wasn't a joke at first. It was, oh my God, dad's about to, flip his lid here. And, it's not like I was out beating my kids or anything like that. I wasn't exploding and kicking the dog, but I was just angry and I would get way more angry than I should have. And the exercise wasn't working. It would help me to feel good, but there were often times where things that I really enjoyed, I just wouldn't enjoy anymore. And it just became overwhelming. And I then started to panic. Am I missing something? These people that I have known for so long that I really love them. I really care for them. That became overwhelming to me. It became paralyzing and I needed a way out. I needed a way out. Um, I I don't think that if we were still in Nashville and still in the United States, I don't think that I would be in the practice that I was in anymore. Not because of the people and not because of the administration. I probably would have gone and just left and gone and done another startup and have left practice. I'd done a couple of startups, but I think that I would have left practice because I was paralyzed.
Startup business or startup practice?
Startup business. Yeah, yeah,
Oh,
startup
interesting.
business. So, I think that I just would have gone and been a chief medical officer somewhere because
Mm,
I could no longer handle what I was doing.
mm.
Just was
It
not coping.
it's interesting because, my, fir one of my first mentors out of residency was my partner, in Newport, Oregon, Stephen Burns, and he actually sat down with me before my first day of working in rural Oregon, and we spent time in a Medicaid-like clinic and then on a Native American reservation. And I asked him, I said, "What is it gonna take? I've been a resident now for 3 years. I know how to be a good resident, but I don't know how to be good out in private practice in a community." And he said, 2 things to me. He said, "It's about, uh, showing up for your patients and being present when you're with them and listening," right? And the second thing is, following up, show up
Yeah.
and follow up. And I actually believe to this day that the reason why I've had some modicum of success in my professional world is because of follow-up. And I
Yeah.
imagine, and is that true in internal medicine in terms of you see a patient, there's an interaction, and then you make a plan, a diagnostic plan and a treatment plan, and it's
Yeah.
really on the responsibility or shoulders of the physician to follow up. Is that fair?
Absolutely. Absolutely. I mean, most of the time when somebody comes to me, they don't know the answer yet. If it's a wellness exam, that's fine, but you still have to follow up the labs that you order to make sure that somebody hasn't developed diabetes or renal failure. But it mostly, when people come to me, there is a question, and I don't know what the answer is. I have suspicions of what I think it is, but I need to order these tests. I need to order these labs. I need to order this scan, and then I will be able to tell you what it is. So it is all about follow up. The follow up is absolutely key. It's paramount.
Mm.
And that was part of what was paralyzing me.
Well,
Just part of it.
I wanna talk about this. I mean, I take care of children, but of course, I have awareness of adult things as well because I'm an adult, and friends of mine, we all we're learning about. I'm a learning about adult medicine because I'm a patient, and friends of mine at my age are patients, etc.
Yeah.
But you, in particular, being an internist from a very early time, um, have training in diagnosing depression, suicide risk, mental health issues, right? And
Yeah.
so, how did it feels like sometimes in medicine there's a disconnect between what we know that's dealing with our
Right.
patients and ourselves, and we're
Yeah.
not like them.
Yep.
And so how did you put that all together? It's like, because you said something to me that really struck out. You said, "I lost interest in things," and we know that that is a warning sign or a symptom of subclinical depression, if I could say that,
Mhm.
or
Yeah, yeah, absolutely.
sadness in life or stress.
Yeah. Yeah.
How did you reconcile those 2 things?
So I don't know that I maybe lost interest, but sometimes it would just be lost focus in the things that I really enjoyed. I couldn't enjoy them sometimes because of the stress and the phone calls and the everything, the things that I used to treat myself. Sometimes I would be riding my bike and I would just have to stop. And I just couldn't. That was kind of my therapeutic place where I just put my shoes on and my feet would go round and around on a bike. And sometimes I'd just have to stop because it was so overwhelming and I just had to pause. And I just couldn't. Sometimes I would just get off and that was it. Um, in looking back on it, I genuinely don't think that I was depressed. I don't think that it was, I mean, I think that it was probably more, I don't know if you can really say that it was an adjustment disorder, but it was poor management. It was just unhappy, I mean, about a lot of this stuff. And I know that that maybe sounds like depression, but I don't know what symptom the SSRI would have taken away. Maybe it would have calmed me down a little bit, and maybe I wouldn't have grabbed my nose so much. I don't know. But the real symptom was that, or the real cure for it was that I needed to get out. I needed to make a change. And I don't know if that's really answering your question or not, but I I genuinely think that I was just in the wrong place.
Hmm.
I did
Well,
have a lot of patients who, I had 5 patients who committed suicide in my 9.5 years that I was in Nashville in private practice. I wrote down all of the names of my patients who actually died, and I wrote down the reason why. And over 9.5 years, I have a really interesting collection of that, and I remember every single patient, actually, when I go back and read about them and read about the day they died and why they died. And I do have 5 patients who died from self-inflicted gunshot wounds, and they were all horrible, horrible situations. Some of them I saw coming, and, one of them I didn't. I really didn't. But some of them I saw coming, and I tried to get them help. I didn't see myself like that. I just genuinely did not see them like that, see myself like that. But, yeah, I don't know, maybe it wasn't very good insight at the time. I mean, I certainly
so
wasn't being honest about it, that's for sure.
so what was it like for your children? I mean, I'm a pediatrician and adjusting, it's one thing if it were you and your wife and you both were 32,
Yeah,
no kids. Hey,
yeah.
let's go to Canada after training. We've seen the residency, but you now have children who I'm taking a guess were 14, 12, and 10 ish.
Mhm. Yep.
And
Yeah, 14, 13, 10. Yeah,
okay, pretty
yeah,
close.
yeah.
And those are really tough ages because it's the awkward age and middle school, early high school kind of thing. And you're taking them from a situation where they're Americans. They were born in the US, they were living here, they were going to US schools and taking them to a different culture. And you were also not living in Seattle, Washington, driving a few hours in a plane and a ferry to get to Victoria. You were
Yeah,
actually in the South,
yeah,
and you were moving to the Pacific Northwest. So
yeah,
what how did they do? And how did you prepare them for I'm curious as a pediatrician, how did you
yeah,
prepare them for
absolutely.
this kind of move?
Yeah, I was the last one on board with the move, actually.
Oh,
I really felt like again, maybe that was just, again, really poor insight, but the kids had not been going to school. Like the last 2 months of their school, they typically go to Ontario for a summer camp every year, and they weren't able to go that year, and they were just being really isolated. And we knew that they were not going to go to in-person school when school started up. And they were like, "That's it. I just, like, let's go do something different." So the ninth grader, my oldest, he was in ninth grade, and he had a lot of really great friends. And he had a very, very tight knit group. And it was definitely harder for him to leave. But he was also very excited about the opportunities. And it was harder for him halfway through ninth grade to make friends. The first day he went to school here, we had just gotten out of quarantine 3 days earlier. And the first day he went to school, everybody was like, "Hey, you're from America. Okay. Have you ever held a gun?" That was the first question that they asked him.
wow. Wow.
Uh, so they were doing in person school here, but everybody left for lunch. Like everybody leaves for lunch. They leave the school. They don't really have a cafeteria there. They leave the school and they go down the street to the grocery store, or they go home. And, now they'll go to Tim Hortons or A&W or something like that that's nearby. And so it was harder for him because there were no sports. Like that's how a lot of boys make their friends, as they play sports with people.
Sure.
And they didn't have any sports that anybody was playing at the time. So it was a little bit more difficult for him. But he's made amazing friends. And then he goes off to camp every summer, and he had great friends there. So that's really where he connected. And that's who he's best friends with now. Then there's my middle son who was halfway through eighth grade, and he showed up. And on the first day of school, they assigned another kid to show him around, and they've been best friends ever since. Like
Wow.
that day, they were just friends.
Mm.
He did not have as close of friends when we left Nashville. I think that he was kind of like, whatever. And but he developed a really, really tight knit group of friends when like almost immediately. And my daughter, she was halfway through fifth grade. She also didn't really have a lot of very close friends when she was there. But the first day of school, when she showed up here halfway through fifth grade, just out and about. And the kids were always outside. And we moved to a great place where my daughter would walk to school. Well, they all walked to school, and she would meet a friend, and that they would go and they would get ice cream, or they would just walk into the pharmacy and get a dog treat because the local pharmacy had a dog treats there, and she would go and she would walk and get a dog treat and then come home and give it to the dogs. I don't know, but she would always be out with her friends, and so it really was quite easy for her as well. And now she's really, really thriving. And once school sports started up, then, again, my oldest did very, very well. So with the friends.
So from a human side of things, you've been now in Canada for 5 or 6 years? Is that about
Yep,
right?
5 years, a little over 5.
So from a human side of things, what have you noticed? What can you tell those American physicians, people who are living in the US, let's just say the general population, uh, what are 3 things that you've noticed as a dad, as a human being, that are different about your life? And again, to be fair, I've lived in the Pacific Northwest. There are cultural differences between the Pacific Northwest and the
Yeah.
South. But what have you noticed as a human being in terms of moving to a different country?
So moving to Canada and moving to Victoria, I mean, Victoria is kind of, again, I'll use the Disney World. I literally have deer, raccoon, rabbits, and bald eagles flying, or well, bald eagles fly. The rest of them are out running around in my front yard. It is very safe. That's one of the things that it took me a while to get to the point where I felt safe here. When again, not to be so that's number one is safety. Number two is opportunities. I think that the kids have the opportunity to participate in sports that maybe they wouldn't be able to play in the United States. Obviously, I mean, I'm sitting down. I am not a large person. I falsified my records and said I'm 5'8". I'm like 5'7" and 3/4. My wife is definitely shorter than I am. So my kids are not giants. They're great, wonderful, very athletic, but they're not giants. And so they weren't going to be able to play football at the 5A school in Nashville where they went. But here they could play rugby, and they got to go to the provincial championships, state championships. They got to do all kinds of fun things, run cross country, run track. They had opportunities. We go skiing all the time together. And that has been something, of course, you can go skiing and you can do all these things elsewhere. But it was just something that it was nice. And sports here is not a business, and it's not the only way to get to college. They're just people are relaxed about it here. I mean, obviously, people go crazy about hockey, but I think that that's just the Canadian way. But it's not life or death, and there's no reason to get in fights in the stands over your kids and yell at the referees and stuff like that. It's different. And the third is just kind of a respect. I think what I've noticed for my kids is that from an early age, they're just kind of taught it's okay. What other people do, what other people believe, what other people say really doesn't affect you. And so let them be them, you be you, everything's fine. And I know that there are lots of pejoratives that people can say about that, and that's fine. It's not really a political thing. It's not just about gender identities or whatever else. It's a respect for being from a different culture. Vancouver Island and Victoria specifically is full of a lot of people from all over the world. It's very British. You know, they say that this is the most British city in Canada. It's very British. Everybody here has accents. The hospitals in the elevators in the hospital have British voices. It's really funny. Uh, and so when they open up and they're all like, you know, going down, it's British accents. It's not something that you would hear in the U.S.
Mm,
But there are people from all over the world here. And I think that people they embrace that. They embrace the differences and they embrace that my friends from Bosnia or from yeah, everywhere. I mean, my friends from Ireland and my friends from Australia, New Zealand, and all over Canada, Poland, Mexico. All of these people come here, and it's a very accepting and open, and like, wow, you have a really interesting story. I love that. That's
mm,
fantastic.
mm.
And that's just that's kind of sorry if I'm not answering your question.
No, you are.
Just
It's perfect.
you
It's
can
it's a
edit
great
out all
answer.
of my
No, no, no. I'm
but
editing 0 out of this. I just wanna quickly interject
yeah,
that, I had to relate to what you just said is about respect, is I, was very honored to give grand rounds at, the University of, Manitoba at Winnipeg at the Children's Hospital there, and before I was even introduced, they read a statement and I forget what they called it, but they read a statement about
land acknowledgement
it
is the
was the
land
land ac
acknowledgement,
it was
right?
the land acknowledgement, and
Yeah,
it was specifically about the native, indigenous folks and the respect and, the intent to acknowledge them and to support them in the way that they wanna be supported.
yeah,
And I was stunned. It was not, "Here's David Spiro, blah, 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 the bio, and get into the talk." This was something that just level set everyone, and, I thought it was so beautiful. And,
yeah,
I have a different understanding. I grew up in New York and, in a heterogeneous culture, but I was not exposed to Native American, culture, and I was for 5 years on a coastal tribe in Oregon, and I learned a
yeah,
lot about, about indigenous people and how important it is to recognize, their history, and, think New Zealand does a pretty good job of it to some degree. I mean, it's always imperfect, right? Because
yeah.
there's, some
It's never enough. I mean,
colonization.
for anybody
It's never
who's
enough. Yeah.
an Indigenous person from Canada who's watching this, it's never enough. There was when we first moved here, and sorry to interrupt. I mean, but when we first moved here, they were just discovering all of the children's bodies
Yes.
at these schools that
I
the
remember
government
reading
had
about that.
taken.
Yeah.
Yeah. So and since then, I have learned and I've heard these patients, and this is like totally hijacking everything. So I apologize, but I'm hearing from all of my patients here that talk about the tragedies for these residential schools where the government took them from there, put them in these residential schools, and tried to make them more Canadian.
Mm,
And they did horrible, horrible. I mean, things that we will not talk about here, but horrible,
mm,
and killed hundreds and hundreds and hundreds of these children, probably thousands, but hundreds on certain school grounds where they go through and they find mass graves of children all over these residential schools. And it's again, that's why it's never enough.
mm,
It's unconscionable what happened, but it is nice to be in a society where you admit that you did something wrong. And the only way that you can learn from that and the only way that you can move on from that and try and move forward uh, to a better, more just society is recognizing that you were wrong.
mm.
I don't know, boy, man, did we go off topic there. So I
Well,
apologize.
we're talking about this is all about the humanness of what we do and how it relates to medicine, and we're physicians and, colleagues. My last question for you is,
Yeah.
the interesting MD. Why did you start a podcast that is focused on supporting, physicians emigrating from the US to Canada? What was the genesis behind your podcast?
Yeah, so I have 2 great friends that we went to med school with, Aaron Fritz and Gopi Shaw. So they're married, and we met them. They have this amazing podcast, like, company, and it's called the Back Table Podcast. And so it's about interventional radiology and ENT and OBGYN and oncology and all of these things. And so they have this uh, great podcast empire that they've built. And we went to see them. They were living in Paris at the time, and we went to see them a couple of years ago for spring break, and we were gonna take our kids. So I was jet lagged, and, we were just talking about the podcast, and I had gotten into listening to podcasts, but I had never thought about doing one. And he made a joke about it, and we were all kinda making jokes about it, and then I was jet lagged, and I woke up at 1 o'clock in the morning and thought, I need to do a podcast. And so over the next 5 hours while my wife was asleep, she had no idea that I was sitting there Googling and researching all the different things that I could do for a podcast. And I wanted to make it about burnout, but I wanted to make it about finding balance and doing something better and so all the things that I had done had been hobbies. So doing triathlons and doing all these weird things and also doing businesses. So I had been a part of a couple of startups and so I thought that that was where it was going to be. And I did a bunch of episodes about that, about different things that doctors can do kind of away from the bedside. But I thought, I needed this. I needed to be in Canada. My burnout was the system, it was my environment, and I needed to be out of it. So why don't we do a couple of episodes about the differences between the US and the Canadian healthcare systems? And that one took off. I think it's now had 40 or 50,000 views, something like that. And I got people that reached out to me. And so I did more and more episodes about this, about, hey, I'm not trying to close the door behind me. It's worked out well for me. And so now I have, my wife jokes that I've become the Moses for US doctors, that I'm trying to lead my people out. It is an alternative. It's not something that, I'm telling that everybody has to move to Canada. But if you find yourself in a position like I was in, that you just need it out, and it's not always about politics and it's not about the system. Sometimes it's just overwhelming and stuck.
Mm,
And like you talked about being brave and all these other things that in making changes. And that's what I'm trying to help people understand, is that if you do need to make a change, that I'm here for you. I can try and help you through this. And so we do a series of, videos about immigration issues and tax issues and, uh, just doctors who have left and what their life is like and what they
mm,
think and what was the process like and do you regret it and are you moving back? So far, nobody has. Um, but it's just one of those things where I think that I've had to tell people that the grass is not always greener. It's not. I've been very, very fortunate. We've been very, very fortunate. But there's definitely grass. And the unknown, I just had lunch with somebody on Friday, and the unknown of moving to Canada, yes, it does sound brave and or stupid to have picked up and moved all the way across the country to the Pacific Southwest, as we have to call it, north of the border. But to move your family and your dogs and move to a place that you'd never seen before and never been to before. But it also takes a certain degree of bravery to stay where you are. If you're miserable and you're unhappy, I mean, what else are you risking? Are you risking your job, your health, your marriage, your safety, your kids' safety? There's risk in that as well. And so that is, I'm trying to highlight some of those things and some of that juxtaposition that people who are like us, who have been in the system, who know, but I'm trying to educate people because there's a lot of misinformation on both sides of the border. Every Canadian thinks that every American has lost their house and they're homeless because they went and got a CT scan. And every American thinks that every Canadian has died on a wait list waiting for an elective surgery. And it's nice to have that conversation and to educate both sides about what it's like and to be open and honest and real about it.
Well, I think my assessment here is that you're a brave and first of all, I really like you. I think we would be close friends if we lived together. We have a lot of commonalities. I've started a couple companies as well, and I've moved at least in the States. But I think that your story is a really interesting one, and I think you are courageous. You and your wife and your kids, you are all courageous to leave because I'm a product. I assume you are to some degree, but my family left Russia and Eastern Europe to come to the States because of persecution. I don't believe you were a victim of persecution in Nashville, but you were also
No,
the commonality there is stress, right? There was some
it's
degree of
stress.
stress and unhappiness, and it takes courage and bravery and support and all of these different things to make it happen. And now you're doing something really beautiful, which is you're opening up your time, which is our most important variable that I always say, to podcast land and supporting folks that want to come and have a different lifestyle.
Yeah. Well, thank you.
It's
I do
beautiful,
appreciate that.
really beautiful. Beautiful story, beautiful to meet you. I would be honored to be on your show if you feel like there would be something for me to talk about. I think it
Well, I
would
think that
be.
we'd probably talk about something.
And I'm an interesting MD, right? I mean,
And
there's
you
something
are.
interesting. It's
Yes,
all
you
good.
are. Again, it was the worst name for a podcast ever. Worst name ever.
Well,
But,
I try to come up
if
with it too. I don't know. Is
it
humid? Is it humid out? And didn't
no,
really
it's
know, but
wonderful. Yours is about humanity and medicine. Mine's makes it sound like I'm a narcissist.
no, 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 no. It is an interesting show, and you're providing value to people who really need to understand the ins and outs of what it would be like to move to Canada from the States. So pleasure to have you on. Would love to have you on at some point in the future. I think that
Of course.
there are so many things that I've written down here that we could talk about. And honestly, I say this with my heart is that I'm sad for the people that you left in Nashville that you were caring for because a physician that writes things down like when people pass not only is a learning opportunity, but also as a remembrance. And I know that you were an excellent physician for them and their loss, but is Canada's gain in Victoria and the community you're in. I am sure that they are very fortunate to have you caring for that population. So,
Well, you're very kind, and I can't thank you enough.
yeah,
And yes, absolutely, you're gonna be on. You're amazing.
well, have a great everyone who's listening. Please join the HUMED movement. We now have at this time of taping almost 41,000 YouTube subscribers and growing. And we're here about telling stories about the human experience. And I think that it's resonating, and hearing stories like Dr. Beck's moved me, and I hope it moved those that are listening to the show tonight. And I hope you all have a great rest of the day. Thanks again, Rob, for being on the show.
Thank you for what you're doing.
Thanks for listening to HUMED with David Sparrow, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.